You wake up with a sore throat. It's the year 1500. You're in London. You go to see a doctor. He listens carefully. He nods. He picks up a knife, not to examine you, not to operate, to let some blood out. Because for roughly 2,000 years, that was the treatment. Sore throat, bleeding. Fever, bleeding. Headache, bleeding. Too much sadness, bleeding. Too much happiness, also bleeding, because happiness was considered a form of excess, and the profession had a solution for excess. This is bloodletting, the most widely practiced medical procedure in human history, and, with the benefit of hindsight, one of the more confident mistakes anyone has ever made. The theory started, as many long-running mistakes do, with someone who was almost right. Hippocrates, working in Greece around 400 BC, noticed something physicians still notice today. Sick people run hot, fevers, inflammation, the body generating heat it can't seem to control. He had a theory. The body ran on 4 fluids: blood, phlegm, yellow bile, and black bile, which covers most of what comes out of a sick person. And that, it turns out, was more or less the entire evidence base. Blood was the hot one. Too much blood made you feverish. It also made you cheerful, sociable, and overly optimistic. All symptoms, apparently, of having too much of it. The English word sanguine still means exactly that. It comes from sanguis, blood. Yellow bile made you irritable. That's where bilious comes from. Black bile made you sad for no obvious reason. That's melancholy. Melas, black, kol, bile. Phlegm made you slow and difficult to excite. Phlegmatic. These words are still in the dictionary. The theory that produced them has been wrong for 2,000 years. The vocabulary survived. Then Galen came along 5 centuries later and turned the whole thing into a cathedral. Hundreds of volumes, a complete system with no gaps, and he got specific, not just remove blood. Galen mapped exactly which vein to open, depending on what was wrong with you. Headache, the vein behind the ear. Liver problems, the left arm. Heart problems, the right arm. Menstrual disorders, a vein in the ankle. The system was so precise, it looked like knowledge. European universities taught it for 14 centuries, not because no one was paying attention, but because something that complete is very hard to argue against. Questioning any part of it meant questioning all of it. And that, for most of those 14 centuries, was not something anyone was prepared to do. Galen had built something too useful to dismantle. The blood was the problem. The profession moved on. For most of that time, bloodletting wasn't performed by doctors. It was performed by barbers. In 1163, Pope Alexander III decided that monks and clergy shouldn't be drawing blood professionally, which, as decisions go, is hard to argue with. The work passed to barber-surgeons. The same man who cut your hair would also, for a modest fee, cut open your veins. He handed you a wooden rod to grip. This made your veins swell and become easier to slice. He opened a vein. He caught the blood in a basin. He wrapped the wound in a bandage. The used bandages were washed and hung outside on the rod to dry. They'd catch the wind and twist, red and white, spiraling slowly in the breeze. You have seen this your entire life. Every barbershop, every high street. The red is blood, the white is bandages, the spinning stripe is the bandages drying. Nobody mentioned what it meant. It was just there. Here is where it gets harder to explain. In 1628, a physician named William Harvey demonstrated something anyone could verify at home. Press your finger against a vein in your forearm, drain it flat, release one end. The blood fills back in from one direction only, always the same direction, always toward the heart. Blood doesn't pool, it moves, continuously, in a closed loop. If blood doesn't accumulate, there is no excess to drain. The entire foundation of bloodletting was gone. Harvey published this. It was read. It was accepted. Then the profession found a workaround. If blood circulates, they argued, then the liver must be constantly manufacturing new blood, and that new blood, arriving hot and excessive, still needed to be purged. The circulation was real. The bloodletting still made sense. Galen's framework absorbed the discovery, rearranged a few sentences, and continued. Harvey had published the proof that should have ended bloodletting. It gave bloodletting a new argument instead. Then came Pierre Louis. In 1836, a French physician did something the profession had never thought to do. He counted 77 patients with pneumonia. Some bled early in their illness, some bled late, some not at all. He tracked the outcomes. He ran the numbers. No difference. The patients who were bled recovered at exactly the same rate as those who weren't. He called this the numerical method. It is what we now call evidence-based medicine. Pierre Louis invented it, more or less, specifically to disprove bloodletting. His colleagues' response: the sample was too small, and besides, clinical judgment built on centuries of experience could not be reduced to arithmetic. Galen had not counted his patients. Galen had observed them. Pierre Louis published his findings. He was largely ignored. His numerical method eventually became the foundation for every clinical trial conducted since. He was right. He was just 200 years too early. The Renaissance happened. Bloodletting continued. The Enlightenment happened. Bloodletting continued. The Scientific Revolution happened. Bloodletting continued. At some point, this stops being a story about medicine and starts being a story about institutions. The most celebrated physician in America at the time was Dr. Benjamin Rush of Philadelphia, signer of the Declaration of Independence, professor of medicine, the man who had trained, directly or indirectly, most of the doctors in the country. Rush believed in bloodletting with a conviction that the profession admired. During the 1793 yellow fever epidemic in Philadelphia, he was removing up to 4/5 of his patients' blood in a single session. Colleagues raised concerns. Rush published his results. His results, by his own accounting, showed the treatment was working. The method, in retrospect, patients who survived after losing 4/5 of their blood were recorded as evidence the treatment had succeeded. Patients who died were recorded as evidence that he hadn't started soon enough. This is called circular reasoning. At the time, it was called authority. Rush was the finest physician in America. His students became the physicians that attended George Washington. Which brings us to December 14th, 1799, Mount Vernon, Virginia. George Washington, 67 years old, retired president, woke up with a severe sore throat and difficulty breathing. 3 physicians were called: Dr. James Craik, Dr. Gustavus Brown, and the youngest of the 3, Dr. Elisha Cullen Dick. Washington was bled 4 times over the course of the day. By the end of it, more than 80 ounces had been removed, roughly 40% of the blood in his body. Dr. Dick objected. He proposed a tracheotomy, cutting a small opening in the windpipe to let Washington breathe past the obstruction. The other 2 physicians overruled him. Too experimental, too risky. Washington died that evening. Dick wrote afterward, "I shall never cease to regret that the operation was not performed." The tracheotomy is now a routine emergency procedure, taught in the first year of medical school, performed in under 2 minutes. Washington died in 1799, 23 years after independence, with the finest physicians in America in attendance. None of that helped. Germ theory arrived in stages. Pasteur published in 1861. Koch identified specific disease-causing bacteria through the 1870s and 80s. By the 1890s, bloodletting had largely disappeared from mainstream medicine. The leech populations of Europe did not recover as quickly. At the peak of the bloodletting era, France alone was importing 40 million leeches a year. Pharmacies stocked them the way they stocked bandages. Leech shortages caused genuine medical crises. Napoleon's army requisitioned them. Several European leech species came close to extinction before the practice finally fell out of fashion. The leeches outlasted it, barely. In 2004, the FDA cleared medicinal leeches as an approved medical device. They are used in reconstructive surgery, reattaching severed fingers, ears, and skin grafts, where they keep blood moving through recovering tissue. They work. They are effective. There is a leech farm in Wales that supplies hospitals across Europe. So bloodletting never fully ended. It narrowed. It specialized. It found a precise application and got regulatory approval. The underlying idea, though, that the body accumulates things that need to be flushed out, that illness is an excess, that the treatment is removal, that idea is still everywhere. It's in every detox tea, every juice cleanse, every supplement that promises to purge something from your system. The product has changed. The logic has not moved. 2,000 years of bleeding people, a century of leeches in Wales, and a very large market for drinks that claim to clean your liver. Galen had no idea how long he'd be right.